Do antibiotics cure the flu or the common cold? Millions of people think they do, but that's a dangerous myth. In this video, you'll learn the difference between viral and bacterial infections and when antibiotics actually work. A young man has a fever, cough, and sore throat and wonders if he needs antibiotics. Not all infections are the same. Viruses are tiny germs that enter your body's cells to reproduce. Bacteria are single-celled organisms. Some are helpful, while others cause disease. Common viral infections include the common cold, influenza, COVID-19, and many viral sore throats. Some ear infections, strep throat, urinary tract infections, and certain types of pneumonia are caused by bacteria. Antibiotics are medicines that kill or stop the growth of bacteria. Antibiotics do not work against viruses. Taking antibiotics for a cold usually won't help you recover faster. Influenza is caused by a virus, not bacteria. Antibiotics should only be used for bacterial infections when prescribed. Misusing antibiotics helps bacteria become resistant. Resistant bacteria become harder to treat. Always complete your prescribed antibiotic course unless your healthcare professional tells you otherwise. Never use someone else's antibiotics. Wash your hands, cover coughs, and stay up to date with recommended vaccinations. Your healthcare provider can determine whether your infection is viral or bacterial. Viruses need different treatment than bacteria. Only use antibiotics when they're needed and prescribed. Understanding the difference between viruses and bacteria helps protect your health and fight antibiotic resistance. Follow PharmaWise for more trusted medicine safety tips.